Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. I am Rubab Zahra on the behalf of University of Management and Technology. This is the second part of my presentation. What are the antihistamines? An antihistamine is a prescription or over-the-counter medication that blocks some of what histamines does. Anti means against, so antihistamines are medicines that work against or block histamine. How are antihistamines classified? Antihistamines are divided into two major subtypes. The first subtype is called H1 receptor antagonists or H1 blockers. This subtype of antihistamines is used to treat allergy symptoms. The second subtype is called H2 receptor antagonists or H2 blockers. They are used to treat gastrointestinal conditions, including gastroesophageal reflux disease, peptic ulcers, gastritis, motion sickness, nausea, and vomiting. The naming structure H1 and H2 tells doctors and scientists the cell type, the location of the histamine receptor that the antihistamine medication blocks. The H1 blocker subtype is further broken down into two groups: first generation antihistamines and second generation antihistamines. What is the first generation? Just like the name implies, the first generation antihistamine were the first type approved by the Food and Drug Administration. They began to be approved in the United States in the 1930s and are still prescribed today. They work on histamine receptor in the brain and spinal cord along with other types of receptors. Most notable about this generation of antihistamines is that they cross the blood-brain barrier which results in drowsiness. What is the second generation? Second generation antihistamines were approved by the FDA and first came to market in 1980s. The second generation antihistamines do not cross the blood-brain barrier to the extent that first generation do and therefore do not cause drowsiness at standard dosage levels. Second generation antihistamines are considered to be safer than first generation antihistamines because they don't cause drowsiness and interact with fewer drugs. Brompheniramine, chlorpheniramine, clesmatine, cyclopentadine, dexochlorpheniramine, diphenhydramine, doxylamine, hydroxyne, phenhydramine. A few examples of second generation over the counter and prescriptions are included: azilistine, loratadine, cetirizine, disloratadine, fexofenadine. If you are taking an antihistamine to help with stomach issues, you are likely taking a H2 antihistamine. A few examples of H2 antihistamines include nizatidine, ranitidine. H1 antihistamines treat allergic rhinitis, hay fever, allergic conjunctivitis, hives, and other skin rashes, colds, food allergies, hypersensitivity to certain drugs, insect bites and stings. First generation H1 antihistamines also treat insomnia, motion sickness, anxiety. H2 antihistamines treat heartburn, gastroesophageal reflux disease, duodenal and gastric ulcers. Other conditions antihistamines treat include eczorrhea, headache, anaphylaxis, vertigo, some type of bone pain. Your healthcare provider may prescribe antihistamines for even other conditions. Some of the common side effects of first generation antihistamines include drowsiness, dry mouth, dry eyes, blurred or double vision, dizziness and headache, low blood pressure, mucus thickening in the airways, rapid heart rate, difficulty urinating, and constipation. Some of the common side effects of second generation antihistamines include headache, cough, tiredness, sore throat, abdominal pain or discomfort, nausea or vomiting. Common side effects of H2 antihistamines include drowsiness, joint or muscle pain, headache, confusion in the elderly, dizziness, breast swelling and tenderness. In what dosage forms are antihistamines available? Antihistamines come in several forms including liquids, lotion, syrups, gels, eye drops, tablets, nasal sprays, creams, capsules, suppositories. There are many questions about antihistamines. First of all, we will discuss the first question, that is, can antihistamines cause fever? Fever is not one of the side effects of antihistamines. Can antihistamines cause constipation? Yes. Some antihistamines such as diphenhydramine, diphenhydramine do cause constipation as side effect. Can antihistamines cause dizziness? Yes, dizziness is a common side effect of some antihistamines. Can antihistamines cause depression? One study of 92 people with chronic itchiness saw that patients who took the antihistamines cetirizine and hydroxyzine reported an increase in the depression and anxiety. The effects of all antihistamines on mood disorders have yet to be studied. Can antihistamines cause high blood pressure? If you are already taking medication for high blood pressure, combining that with an antihistamine can increase your heart rate and raise your blood pressure. Talk to your healthcare provider about your options. Do antihistamines cause dementia? Long term use of some antihistamines may increase your risk of dementia. Diphenhydramine blocks the effect of neurotransmitter called acetylcholine. This neurotransmitter is vital for memory and learning. Diphenhydramine increased the risk of dementia by 54% in one 3,000 patient study followed for 7 years. What question should I ask my healthcare provider? What type of antihistamine would work best for me? How do I properly take the prescribed antihistamine? What side effects might occur with the recommended medication? What antihistamine won't interfere with the current medications I am taking? When or for what conditions does taking an antihistamine that would make me drowsy make sense? Can I live my life normally while using this medication? Can I drive? Can I operate heavy machinery? Can I take antihistamine if I am pregnant, planning to become pregnancy mom? I am breastfeeding. Can antihistamines be safely given to my child? What are the consequences if I don't take an antihistamine to help with my allergies? Thank you so much.